as we begin the next phase of our bipartisan effort to combat Lyme and tick-borne diseases. We will be building support this week for a bill that has been introduced by Senator Ayotte and myself with the strong involvement and leadership of Senator Gillibrand. S-1503, the Lyme and Tick-Borne Disease Prevention, Education, Research Act, with 13 co-sponsors, a bipartisan bill that is critically important to public health. And today, we will be welcoming a number of my friends and constituents from Connecticut and around the country who are experts to provide briefings to our staff in sessions that have been organized by myself, Senator Ayotte, and Senator Gillibrand. We're very pleased to welcome some of the leaders of this effort. John Aucott, who is an assistant professor of medicine at the Johns Hopkins School of Medicine. Dr. Brian Fallon, a good friend and leading expert in this area. He is a professor at the Columbia College of Physicians and Surgeons. Ali Hilfiger, who has been a survivor and strong supporter and advocate. Rebecca Tibble, a fourth grade teacher from my home state of Connecticut, who's been battling Lyme disease since August of 2014. And David Roth, also a leader, a longstanding Lyme disease patient advocate from New York, who in his day job is a managing director at the private investment group Blackstone. These individuals are here to call attention, to build support, to solving a disease that literally is exploding exponentially in this country and now constitutes an epidemic that literally impinges and cripples the lives of millions of Americans. The Center for Disease Control and Prevention indicates that more than 36,000 Americans suffered from Lyme disease in 2013. But it says the number who actually contracted this disease is probably 10 times higher because it is undetected and undiagnosed in so many people. And it is underreported even when it is discovered in individuals. Most of the cases of Lyme disease occur in a limited number of states. 96% of them occur in Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Vermont, Virginia, and Wisconsin. I name them because the senators of those states ought to be behind this bill, every single one of them. But those cases are only the ones reported. And in many states, there is no systematic reporting of Lyme. And so the full extent, the breadth and depth of this epidemic is truly unknown. Now, we know in this body how to respond and recognize a public health threat. It was done in Ebola. It is done for influenza. It hopefully will be done for Zika. What's needed is the same kind of bipartisan awareness and support for legislation to help people who suffer from Lyme and other tick-borne diseases. I'm sometimes asked, why has the Congress failed to recognize and respond to this severe public health threat? There's no good explanation except for the underreporting, the underawareness, and that is no excuse. In the meantime, the cases of Lyme are exploding in number and their severity impacts our economy as well as quality of life for Americans. It affects people's ability to perform their jobs, children's ability to go to school, families' ability to function normally. The disease, if undetected and untreated, can cause the most severe kinds of pain and disability. Lyme disease is named after a town in my state. I've always felt that it was tremendously unfair for the beautiful and wonderful town of Lyme to bear the burden of this disease having its name. But regardless of the name, the burden is on the entire country, not simply on Connecticut, not simply on the Northeast, not simply on any part of the country or profession to take action. And that action must include provisions of this bill that strengthen Lyme disease surveillance and reporting, create a physician education program, establish an epidemiological research objective set for tick-borne diseases, and prepare regular reports to Congress on the progress of efforts to combat these devastating tick-borne diseases. And the effects are devastating, pernicious and insidious, creeping into every aspect of a victim's life. Our bill has earned the support of 13 senators from both parties, including 5 members of the HELP Committee. When it comes to fighting Lyme, there is no partisan difference. The ticks who carry this disease don't know a red state from a blue one. They don't make any discrimination between the boundaries of different states. And the devastating diseases that can spring from these ticks and associated with them are common to our entire country and therefore demand a national response and a federal program that we have outlined in this bill. I am proud to join with Senator Ayotte and Senator Gillibrand in this effort. I urge my colleagues to support this bill, to send your staff to the briefing that we have today. I thank others from Connecticut, such as Alexandra Cohn, who are going to be coming today. And I look forward to continuing this fight, which has to be one of nationwide commitment.